Welcome. Another great self-help video I want to share with you on how you can conquer shoulder pain. Realize that the majority of things that we do is in a forward, rounded shoulder position. Looking down, texting, typing, driving. We are what we call pronated. Pronation of the shoulders means it goes this way. Retraction of the shoulders means the hands are facing forward and your shoulders come back and your chest is up. That is healthy. So when we're pronated, we are internally rotated. Look at the back of my hands are facing you. If my hands, the front of my hands face you, we are externally rotating, and now we are in anatomical normal position. But when we are pronated like this, the shoulders are rounded. When the shoulders are rounded, it causes the chest muscles to contract more, pulling the shoulders more forward. As a result of that, the rhomboid muscles between our shoulder blades become stretched because they're not pulling back. The shoulder blades are not coming closer together, they're going further away. When the shoulders become rounded, the space between the acromion process, the top of the shoulder area, and the top of the head of the humerus, which is the top of the arm bone, becomes narrower. In other words, when the shoulder externally rotates and comes back in anatomical position, the space becomes wider. As it rolls forward, the space becomes more narrower. As that space becomes more narrower, those delicate tendons like the supraspinatus tendon, which is the most commonly involved rotator cuff tendon, that's one of the four, that's the area that starts to tear, starts to fray, starts to become inflamed, tendinitis. We have other important tendons as well that run right through the top of that shoulder area. So understand that the supraspinatus, the function of it, if I turn sideways here, is to abduct the area, to bring it straight up. Now, when the shoulder is rotated forward, it cannot come up. It starts to jam. It starts to jam right into that top of the acromion region because it's all internally rotated. So as the shoulder stays internally rotated, and as you continue to work or do your job or drive or just lift your arm up every day, you're fraying on that tendon. You're fraying it more and more, and you're causing degeneration. Potential calcification can even occur in that area, quite common. But as that tendon becomes more frayed, it's like a rubber band. You keep fraying it until eventually it starts to tear, and that's what we call a rotator cuff tear or a supraspinatus tear, quite commonly seen just from repetitive daily use, not even trauma. So it's very important that this exercise to be done regularly to make sure that we externally rotate the arms, okay, anatomical position. This opens up the chest. It gives space in the shoulder area so the supraspinatus tendon can work normally, it can abduct normally, because remember, when it's internally rotated, it becomes jammed. I hope that you understand this. This is very important. So the one stretch we're going to do is what we call the 2-in-1 type of stretch, that we're going to actually work and strengthen the rhomboids and stretch the chest at the same time. Very simple stretch, very easy. You can do it anywhere at any time. What we're going to do is we're going to take our hands behind our back. It's going to be in this position. Hands are going to be the front of the hands. The palms are going to be facing down. Okay, so you can see here. Clasp your fingers together like this. Palms facing down. From the side, you can see me. From the back again, palms facing down. So now what we're going to do is we are going to push those palms towards the floor, but we're really going to push hard. And when we push down, I want you to bring the shoulders back and stretch the chest out. So as you stretch the chest out, I want you to pinch the shoulder blades together. Go ahead, push those hands to the floor and just hold it there about 10 seconds. Good, relax. Now I know it kind of looks funny when you're in that position. This is how it looks sideways. But now when we push down again, I want you to bring those shoulders back as you push that chest forward. Okay, and as you push down, I want you to squeeze those shoulder blades together. Very important. Let's go ahead and push down. As you push down, you'll feel the shoulder blades come together, pinch them together, and bring your chest as high as you can as your head is going high towards the ceiling. As your head comes up, it stretches the chest muscles by itself and allows your shoulder blades to pinch as those rhomboids continue to contract as the shoulder blades come together. Now this type of stretch, you can do about 6 to 8 sets of these, about 10 seconds each. Remember that the hands are facing downwards, okay? Very important. And as they face downwards, as you interclasp your fingers, you're going to push down, head comes up, stretching of those chest muscles, pinching the shoulder blades together, holding it 10 seconds, and you'll do about 6 to 8 sets of those. 6 to 8 repetitions, that is. So you'll do those as often as you like, but I like you to do them regularly, at least every single day. You want to do it twice a day, 3 times a day, it's okay. But make sure you pinch those shoulder blades together because you want to contract those rhomboid muscles. I ask you to share this video with others. Subscribe if you haven't so you can continue to receive the best of the self-help videos here on the internet. And most important, make it a great day. I'm Dr. Alan Mandell.